India, a nation grappling with a staggering cervical cancer burden, one-fifth of the global total, is launching a monumental initiative to combat this preventable disease. This ambitious program targets the root cause, the human papillomavirus, HPV, responsible for the vast majority of cervical cancer cases within the country. While HPV vaccines have been available privately in India since 2008, uptake remains disappointingly low. This initiative, therefore, represents a critical turning point in the fight against this devastating illness. The core strategy revolves around empowering India's extensive network of healthcare professionals. Tens of thousands of doctors are currently undergoing intensive training to become advocates for HPV vaccination. This massive training program is a cornerstone of the effort to significantly improve vaccination rates and ultimately eliminate cervical cancer as a public health threat. The challenge is multifaceted. High costs associated with imported vaccines have historically hindered widespread adoption. Furthermore, persistent misinformation, fueled by unfounded fears stemming from unrelated incidents during past vaccine trials, has created significant hesitancy among the population. This baggage, as Sutapa Biswas, co-founder of the Cancer Foundation of India, describes it, represents a major hurdle that must be overcome through targeted education and effective communication strategies. A significant game-changer is the recent commencement of domestic HPV vaccine production in India. This development promises to dramatically reduce costs, making the vaccine far more accessible to a larger segment of the population. The government's anticipated inclusion of the vaccine into the national vaccination program, expected sometime in the coming year, represents a decisive commitment to tackling this public health crisis head-on. Last year, a pilot program saw over 11,000 members of the Federation of Obstetric and Gynecological Societies of India, FOGSI, receive virtual training. From this cohort, 100 exceptional doctors have been selected as national HPV faculty members. Their crucial role is to train an additional 500 general physicians from the Indian Medical Association, IMA, over the next 6 months. This cascade approach, designed to reach a vast number of healthcare professionals, is intended to generate widespread confidence in the vaccine's safety and efficacy. The training curriculum is comprehensive, covering critical aspects such as accurate dosages, global best practices outlined by the World Health Organization, WHO, in its campaign to eliminate cervical cancer, and strategies for effectively addressing common public concerns and misinformation. Addressing the sluggish implementation of India's existing cervical screening programs is also a key component of the training, emphasizing early detection and prevention. Dr. Gainshkumer highlights the urgency of the situation. Every 7 to 8 minutes, a woman in India dies from cervical cancer, a disease that is entirely preventable. This stark reality underscores the vital importance of this large-scale initiative. The program's success hinges on dispelling the myths and fears surrounding HPV vaccination, increasing public awareness of the disease's devastating impact, and ultimately saving countless lives. This is more than just a vaccination campaign. It's a comprehensive strategy for public health transformation. The goal is not merely to increase vaccination rates. It is to build confidence, to empower healthcare workers, and to transform public perception, ultimately paving the way for the eradication of cervical cancer in India. The scale of the problem is immense, but so too is the potential impact of this ambitious and vital undertaking. The future of cervical cancer prevention in India rests on the success of this initiative, a testament to the nation's commitment to the health and well-being of its citizens. The fight for a healthier India, free from the burden of preventable cervical cancer deaths, is now underway. This ambitious program, with its far-reaching impact, promises a brighter and healthier future for millions of Indian women. The comprehensive training program, coupled with the government's commitment to making the vaccine readily available, offers hope for a significant reduction in cervical cancer incidence and mortality. The battle against this preventable disease requires a multi-pronged approach, combining medical advancements with effective public health strategies. India's commitment to this fight demonstrates a powerful dedication to the well-being of its citizens. The long-term implications of this initiative extend far beyond the immediate impact of increased vaccination rates. It symbolizes a larger shift in public health priorities and a renewed focus on preventative care. This ambitious endeavor aims to not only save lives, but also to empower communities and transform the landscape of women's health in India. The success of this initiative will serve as a powerful model for other nations grappling with the global challenge of cervical cancer prevention.